Now, if you were to follow a busy doctor as he makes his daily round of calls, you'd find yourself having a mighty busy time keeping up with him. Time out for many men of medicine usually means just long enough to enjoy a cigarette. And because they know what a pleasure it is to smoke a mild, good-tasting cigarette, they're particular about the brand they choose. In a repeated national survey, doctors in all branches of medicine, doctors in all parts of the country were asked, "What cigarette do you smoke, doctor?" Once again, the brand named most was Camel. Yes, according to this repeated nationwide survey, more doctors smoke Camels than any other cigarette. Why not change to Camels for the next 30 days and see what a difference it makes in your smoking enjoyment? See how Camels agree with your throat. See how mild and good tasting a cigarette can be.
I don't get it. Congress isn't passing the health care reform America wants.
Problem is, they don't get it.
We've been clear about the reforms we want.
Private health insurance we can all have even if we've been sick. Coverage we can keep even if we change or lose our jobs. Coverage we can afford.
And why can't Congress write a law like that?
That's a very good question.
Nothing has shined a light on the crisis in institutions like the arrival of COVID on the American shores in late 2019. Between administrative blunders and an overwhelmed hospital system, the United States private health care was no match for the virus. When the then presidential hopeful Joe Biden was on the campaign trail during the Democratic primary, he ran on adding a public option to the already existing ACA. Can COVID finally be the gateway to socialized medicine in the United States? What is Medicare for all, and is it really an end to the for-profit healthcare system? We'll ask these questions and more. This is Revolution.
On September 1st, 1964, Senator Barry M. Goldwater interrupted his vacation cruise and headed for shore in a big hurry. Destination, Washington, D.C. He arrived just in time to cast his vote. No. Then he turned around and headed back. Senator Goldwater flew across the continent twice, almost 6,000 miles, to vote against a program of hospital insurance for older Americans. As he said in the Atlanta Constitution on January 26, 1963, "I've got my own Medicare plan. I've got an intern or a son-in-law." Flip answers do not solve the problems of human beings. President Johnson wants a program of hospital insurance for older Americans. He is determined to see this program passed in the next Congress. Vote for President Johnson on November 3rd. The stakes are too high for you to stay home.
Hi, Louise. How was your day?
Well, fine, Harry, until now.
Gee, Louise, you look like you've seen a ghost.
Well, it's worse than that. I've just read the Clinton Health Security Plan.
Healthcare reform sounds like a great idea to me.
Well, I know, but some of these details sure scare the heck out of me.
Like what?
Well, like for example, it says here on page 3764 that under the Clinton Health Security Plan, we could get sick.
That's terrible.
Well, I know. And look at this, it gets worse. On page 12,743, no, I got that wrong. It's page 27,655. It says that eventually we are all going to die.
Under the Clinton health plan? You mean after Bill and Hillary put all those new bureaucrats and taxes on us, we're still all gonna die?
Even Leon Panetta.
Wow, that is scary. I've never been so frightened in all my life.
Me neither, Harry.
There's got to be a better way.